with Dr. Emer's office. We're doing a little bit of cheek filler today. So we're going to give our patient a little bit of lateral lift and also some anterior support right in here. So when we give some deep structural support to this aspect of the cheek, not only are we going to get a really nice OG curve, but we're also going to be able to keep this part of the cheek from feeling heavy. So, you know, a lot of patients don't want to overdo filling in the nasolabial folds, and I totally agree with that. So what we do is build up this little triangle right in here and along the lateral cheek. So what she's going to have is a really nice, elegant high cheekbone where her blush is going to sit really well and her highlight will sit well, and she'll feel like it is lifting that lower part of the face, but also not going to be too cheeky looking when she smiles. So I'm going to start on this side here. Naturally, we'll have a little bit of asymmetry, so I'm going to start by building up this lateral portion of her cheek and then move around. So we're going to be, first poke, right on bone here. And so we're just going to make some small aliquots of filler. And we're using Restylane Define, and so this filler has a lot of lifting power. So even in small doses, you can already start to see this shape taking effect. Doing okay? Mm-hmm. Amazing. You can already see how much she's lifting up here. So typically when you get filler, are you getting one syringe at a time, or how do you normally go about it? What's your preference?
Me? Mm-hmm. Yeah, I like to do the build on.
Build as you go?
Yeah.
Perfect. And I always think it's important to really analyze your patient from all angles, not just from the side, but also taking a moment to come from the front as well. Okay, go ahead and smile big and relax. Perfect. So here we're going to, through the deep fat pad here for some lifting support. Perfect. Yeah, really nice. Smile big. Perfect, and relax. Now these injections are deep on bone, so we're really using this filler to mimic bone structure. So as we age, we're losing, can you just swap out that needle for me, please? As we age, we're losing not just the collagen elastin in our skin, but we're also losing the density in our bones. So your fat pads shift and the muscle changes and your bone structure changes as well. They tend to settle in around the lips, around the eyes, and then the cheekbones. So what we want to do is just make sure that we're keeping those structures really defined and intact, and that's how we get that nice angled look that we like. Smile big and relax. Smile big again and relax. Look it from the front one more time. Smile big. And relax. Good. So the majority of my syringe was actually used over on this left side. And it was because we're looking to build up the height and the curvature of this left cheek. So I'll give you the mirror and you'll see sort of what we built up. Go ahead and take a peek. So now you see that nice lifted cheekbone, and this will keep the nasolabial from looking a little bit too heavy, so we love that.
Thank you.
What do you think?
I love it.
Awesome. All right, everyone, so that was Restylane Define to the cheekbone, and that was just one syringe. So like our patient said, you can build as you go, and that's one of the beautiful things about filler. If you want to start slow, you can, and you just build up, but you know, sometimes one is enough, and sometimes we jump in for more.
Thank
All right,
you so much.
bye everyone, thanks for watching.